Well, hi class. This is Dr. Sean. I'm your anatomy teacher, and these are just a bunch of bones. So we're going to get some of the bones of the class. The bare bones, just got a few things to move over here. Vertebra and neck bones and things like that. You know, neck bones are good for soup and everything like that too, right? So, anyway, every week I'll be doing a couple videos, and this is going to be not number one, but this is going to be one of the ones. What I want to talk to you guys about is due dates and discussion boards. So those are two main things very important in this class. Discussion boards, as you know, is one of the first things that we do each of the weeks, and that'll have a question. It'll say, you know, discuss something about implants of something or whatever. Now, what I'd love you to do, I'll put examples before each one or some hints and stuff like that. Feel free to use those kind of things. If you're going to pull something from the web and just use it outright as your work, make sure that you have a proper reference, and you probably won't get as much points because it's not in your words, which is what I want to see. I want to see as a discussion, right? So we want to discuss the issue. So there'll be things that I'll post in there, and then you can respond to those. And when you respond to them, to get the most points, respond to two other people in the class. Not just one, but two. And not just yourself. And not just saying things like, oh, what a great idea. Oh, I really like what you wrote. Oh, I agree with you. So what? But I agree with you, however, and then continue. I agree with you, and blah, 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 whatever. Add something to it. Maybe a personal experience or something like that, or some kind of thing, okay? And the reason we want to do that is because we're trying to have, like, more interaction. And I'd love to have more interaction with you guys. I know it's kind of rough sometimes to look on your phones or on your computers or whatever it is you guys are doing and look up all the stuff and find everything that we need to find and just keep up with things. So that's important for discussion boards. Don't go crazy. I mean, you know, get some basic information. I want to see your opinion or if you have any personal experience with that kind of thing, whatever those are. The first one's like homeostasis, and here's the hint. Homeostasis means homeo means same, and stasis means to be still, like to be static, right? The same stillness or the same level is what it really means. So in your house, you have a thermostat that maintains the homeostasis of the temperature in your house. If you set it to 72 degrees, if it gets way below that, it turns on the heater and brings it back to 72. If it gets too hot, it turns off the heater and then it turns on the air conditioner. Right? That's what it's supposed to do. Our bodies are the same way. We have so many mechanisms of the way our body works. You know, your own temperature, your acid-base balance, your fluid balances in different tissues and different places and all this kind of stuff. And there's all sorts of them, which are really interesting. Hormonal imbalances and things like that, digestive and enzymatic or enzymes and things like those, which we'll talk about as we go through the class, which is cool and groovy. And I just want you to get a good working knowledge of some of those things. Homeostasis is kind of a word that we have to have known. There's certain words you just got to know to kind of prove that you went through the class or something. Other one is going to be mitochondria. Whenever you hear that word, you should say the powerhouse of the cell, which everybody's going to always remember. And 40 years from now, you're going to be like, someone say, oh, you mean mitochondria? Oh, the powerhouse of the cell. And they go, yeah, you in that class too? Yeah. Anyway, that's discussion boards. Part 2 is due dates. Now, due dates are super important. Notice the due dates that they have in the Canvas thing. We'll say like, due Wednesday at 2:59 a.m. What the heck, 2:59 a.m.? That's ridiculous. That's to account for where you're at versus Eastern time or Pacific time. Okay, we want to make sure that everybody gets a chance to turn in by that midnight. So best practices is to turn it in the day before. I'll be checking them, right? And we'll look at those. Now there is deductions that occur, and if you've waited more than 7 days to turn something in, that's one full week, you might not get any points. So I want you to make sure that if you're having any problems, you let me know. You know, send me an email or something. Say, hey, computer died. Internet went out. Big storm. Kid in the hospital. Dog is sick. My tire blew out. Whatever it is that you had to deal with. I mean, these things happen. We understand that, and it's cool. And so just take a breath. You can do this. I'm telling you, and I'm gonna support you through the whole thing. So keep on going. And if you feel like you're falling behind, get a hold of me. I mean, there's tutoring that we have available, and there's other resources that we have available, and this stuff. And the whole idea of this class is actually to have you pass it. We want to pass it and get that information into the head from this computer or wherever you are on your phone or something, into your head, and then you'll remember it. And then later on, when you're a dental hygienist or you're a nurse or you're becoming a doctor or you're becoming a physician's assistant or a nurse practitioner, whatever it is you're becoming, maybe you'll remember something. Anyway, this is Dr. Sean. Take care, have a good day, and we'll talk to you soon on the next one. So just keep in touch with this. If it's on the YouTube channel here, just go ahead and subscribe. That way it's easier for you to get them. You can unsubscribe later if you want to. No worries. We'll talk to you later. Take care and have a good day. Bye. Any questions? Email me or get me on the discussions, or best way is just to email me through Canvas is the best. Talk to you later. Bye.